everyone, we are live. We are running live. We're going to see everyone is here. Welcome. I'm Dr. Stephen Palter. I'm here at Gold Coast IVF, and we're here for National Infertility Awareness Week and Ask Me Anything. So we'll make sure that the feed is here. We're going to hang out for about an hour, and we're going to talk about fertility. We're going to talk about COVID. We're going to talk about restarting. We're going to talk about happy news, actually, because we have some out in New York. Hi, Tashina. We're going to ask everyone to say hello as we get started. And we're going to bring Katie in and see if she comes with us and see if we can get her here with us. KK is our success coach. If she comes, we were having some internet connection issues at nighttime when sort of everyone starts doing their video chats here. So we'll see if we can get everyone on board. So I'm going to talk about sort of what's happened. KK is our relationship manager and she's our success coach. And we'll see if we're able to get her. The comments are coming in, so we know that we're live. Hey everyone, Caroline, Heather, everyone, welcome. Say hello when you come. We got a lot of the local Gold Coast IVF patients here, but we've got other people joining us as well. So it's so exciting. So I'm going to give you kind of a laydown of what's been happening. We have monthly meetups at Gold Coast, and it's with our success coach. And what we want to do is, it's because we consider ourselves a community. We have a patient party every year, but we don't call it the patient party. We call it our family reunion because we have about 600 people that come, and some of the kids are 15 years old. They come back and they visit us every year. And it's because we feel like we're a giant family. And so KK's coming in. We're excited that she's here. We'll see if we can find where she is and see if we can bring her live. Her connection was not sure if her connection is going to work, but we'll try. And so what happens is we have those every month, and we talk about a topic, and it's really a way that everyone can connect with each other and the families can support each other. We surveyed like 200 of our patients who had finished about what meant the most to them and how they could help people. It was really that they wanted to help people that were just starting, who were like them. They wanted to be able to help someone that was starting and give back. And so I think we're all going to do that together as a community here. We're going to have everyone come together. We're going to ask questions, and we're going to have everyone. Hey, Michelle, we're going to work together. And we've done surveys of patients because I've been running a lot of COVID education. We have about 200 questions that have come in from people. And so we'll share that with everyone tonight. So let me tell you what's happening. Our topic is Ask Me Anything. We're going to take questions from you guys in the audience. We're going to try and make this one super informal. And so let's talk about sort of where we are. All of our Gold Coast IVF patients, we're in Long Island. We're sort of right in the heart of this. We had, a huge number of cases here, and we actually have good news. The hospital has discharged its 1,000th patient. So we are from the hospital network, so we were like totally ecstatic about that. That like anything they imagined before they would just get them to survival, and now people are really going home. They're getting off the ventilators and they're going home. And we had kind of an amazing story that I shared. One of the doctors from one of the local hospitals told me this. It was a pregnancy story. It was a woman who got COVID, and she was 34 weeks pregnant, and they ended up putting her in a medically induced coma, and she was right on the verge. Like, it didn't look like she was going to survive, and she ended up having an emergency C-section. The baby survived. She survived. She was in a coma, and after like 11 days, she gets better, and she gets better, and she's going to go home. And just as she's going to go home, they find out from the hospital that the baby's going to have a pediatrician visit. And so they arrange for the baby to meet her outside just as she was leaving. And she'd never met her baby. And so when she left, all the employees of the hospital were applauding, like the entire hospital. And what they do in the hospitals here in New York is they play Here Comes the Sun when everyone gets discharged. And so what happened was here, they did that, and then as she went, they played it for her. Everyone applauded because everyone knew who this person was. And then everyone knew who she was. And she went out and she met the baby and sort of like exploded. It was the feel-good story of the century, and everyone applauded for her. They cried, and one of the doctors just filmed it on his cell phone, and it's like the #1 story around the world, just coming here from New York, people coming together. Hey, Carol, Michelle, everyone who's here with us. It was just really the story of coming and winning and beating it. So we were really, really happy about that. So let's talk about sort of our information now related to COVID. So everyone was talking about the shutdown. The shutdown was the biggest thing, and it came from the American Society of Reproductive Medicine. And we've got some great news, including reopening. Woo! So we're going to share that with you. We're calling everyone, and they're coming in. So basically what happened is the guidelines came out one day, and that basically we had to stop fertility treatment in the United States. Some guidelines had come a couple days earlier, the same thing from other countries. In New York, it was national in the United States. What they said was that we had to suspend initiation of new treatment cycles, including IUI and IVF. We had to stop retrievals and transfers and anything that wasn't really emergent, and to cancel all transfers of embryos and freeze everything that was in cycle, and continue to care for patients, but to try and freeze them and stop, and to suspend elective surgeries and all non-urgent diagnostic procedures, and then switch everything to telehealth. So we did this, and immediately I was kind of overwhelmed that how are we going to do this? There was never a time when we had to stop treatment, like for a specialty in the country. And I actually I have an education platform I use for physicians. We've trained like 30,000 physicians almost in fertility on different events. And so what we did was we wanted to, so what happened was we stopped our treatment because they're so dangerous around here. And there's been some new guidelines that came out explaining this. And what it said was, they clarified it, but they've kept those in place. But what's happened is clarified it and said that one, fertility is considered essential, and that if someone was undergoing chemotherapy and it was all over, that they could continue. It had to be done in a safe way. And in New York, it really wasn't possible. There wasn't protective equipment. About 1/3 of the people walking around were asymptomatic and infected. We know that because they had the hospital was testing people in labor. And so when they were testing people in labor who were healthy and asymptomatic, depending on the zip code where you live on Long Island, between 10 and 30% were positive. And I was running these events with doctors from Wuhan and Northern Italy and New York. And what happened was they said that everyone was getting infected from their coworkers and patients who they thought were healthy. And that's why everyone went to the social isolation, and everyone started doing the distancing and the masks. So that was really the issue. So we paused everything. It's been about a month, and we've been doing these events. We've run 6 now. We ran 2 patient events. We ran 1 for general OBGYNs, and we ran 2 for infertility doctors. And what you should know is the fertility doctors were totally torn over this. There were some people in states where they had very few cases where they never closed. They just rejected the guidance, and others started to open. But there were places where people got exposed and they got sick. And there have been deaths. I mean, there have been patients around the country and physicians who died. So we have to take this really serious. I mean, anyone of you that are on Long Island know how serious this could be. So as new information has come out, the hospitals are now beginning to schedule elective surgeries for the middle of next month for May. We've been for telemedicine and for people who are for telemedicine and for people who are doing who needed like a B scan or something like that to make sure they weren't having an attack. We did that. But now what's going to happen is we're up again. So we're using lessons that we learned from Italy and China about how to do that. We use what we call the Italian supermarket. So people drive up, they're screened by phone beforehand before they come in. We call them from outside, so you can come in, but the patients have to wear a mask. The staff who interact with you have a mask. All the surfaces disinfected. We have an air system that actually in the laboratory that model to actually kill virus and COVID, one of the few places that has the life air system. And we also disinfect the surfaces, and we have disinfect for our ultrasound probes, but everything's social distanced. Everyone's, we don't have people waiting in the waiting room. You check in, you get screened from the lobby, you come in, your family or partner would stay outside, you do your thing, you leave, and then we exit you over the phone. So we're still doing our new patients and our consults on the phone, but for those inpatient things, we're starting up our cycles again in a very controlled way. We guarantee that it's safe, and guidance is still coming out. So before we start our retrievals, still it's being worked on in the country, what role testing will have, and the hospital systems here are kind of at the forefront of that. That's not part of the national system yet, but it's being rolled out. So we're going to be doing that as well. So let's see what else I can tell you. I'm going to go through the questions that we have. So surgery, people are asking, can we start testing? So that's going to be starting up again. Can we do surgery? So it's interesting. The New York State governor came out with a clarification statement about fertility and reproductive services. Marilyn Kasica, who's the head of the family unit of the Department of Health, actually came on our webinar and spoke and said that the New York State governor declared all reproductive treatments, and that was fertility treatments, testing, all fertility treatments, and surgery for endometriosis and fibroids as essential. So it's really, they left it that it is between the doctor and the patient to decide what needed to be done and what wait. And I think that's the way it is. Jennifer, you're saying frozen embryo transfers we're going to be able to do. So that's basically where we are. And elective surgeries are going to start being scheduled as well. So let me start answering some of the questions. We're going to ask you guys, feel free to ask anything from the audience. We're going to share some links with things in the comments that you guys can work with. And what we have is the, pregnancy. So a lot of people are asking if you're already pregnant. Are partners allowed? Internet, we're going to wait for the internet to come back. We're dealing with bandwidth issues here. So let's see if it comes back. We're going to start buffering again. Come on, internet. Are you guys there? Can you hear me? Are we starting to move yet? So we're going to switch over to a different, okay, we're moving again. All right, we're going to see if we come back. It's video conferencing time from the school. The people are watching movies when they get home, and bandwidth starts to lag. So if you could leave a comment that we're going to be coming back, just give us a second. All right, we're going to be coming back in a second here. Just give us a second, and we're going to catch up. So it's going to. So a lot of people are asking us, are partners allowed? Just write a comment to everyone that it's catch up in a second. A lot of people are asking us, are partners allowed in the hospital? And this was a big fight nationally. So what's happening now in New York is all the New York hospitals decided that they were going to allow partners to be in the delivery room with them. But everyone's masked, and if anyone has any symptoms, they're not going to let them come in. So that's allowed. So there's a lot of questions. The safety of pregnancy. That's a huge one that everyone's asking us. So we have some questions that came out. Uterine mapping. Yeah, we're going to do mapping. We're starting those next week. And what's happening with insurance? Insurance is still really confusing. I'm just going to check the feed if you guys can see it. It's okay. So the insurance, it's not clear what's going to happen if there were limits. We're authorizing everyone. So we're working on that. We're not sure what's happening, but so far everything seems to be moving through. So that seems good. There were some concerns if people were passing cutoffs that month. So that would be, we're going to appeal all those on a case-by-case basis. So here's the question about pregnancy. So everyone's asking, is there risks to the baby? Can the baby be infected? So there has not been yet a single case that has been proven of transmission from the mom to the baby in utero. The virus hasn't been detected in cord blood. The virus hasn't been detected in amniotic fluid or in breast milk, which is huge. The other great thing is that the pregnant women are not at more risk of having more severe symptoms. With flu and other viruses, they are, but somehow remarkably with COVID, both children and so Alana, and frozen embryo transfers and tachina retrievals are going back online. But on a really, really controlled basis and case by case, we're assessing risk benefit for each patient and doing what we think is safe. So going back to the baby, there hasn't been a transmission of a baby in utero that's been documented anywhere in the world, China, Italy, or New York, and they've been testing them pretty extensively. But there have been cases where a mother is positive and the baby gets infected after birth. And so that's been the issue with breastfeeding. New York State Department of Health and the hospital network has been really pretty strong on letting them breastfeed. In China, they don't. They were separating the moms and the babies. But here you can breastfeed, but the mother has to wear a mask, wash her hands from the baby can be infected from the mom, but that doesn't mean that you can't breastfeed or you can't be a baby. Higher which is a question. So that's a huge one. There was a study that came out that raised some concern, and frankly, I talked to a lot of fertility experts. One in Chicago did an analysis of it for me. And most people thought that the study was, I think, what's the scientific term we use? Garbage. And that's the polite one. The other one is starts with bull. So basically, they said that there was an increased risk of miscarriage and an increased risk of preterm birth and premature rupture. But it was really really poorly done. Some of the studies, it was like a combination of all past information. So some of the people, a lot of the patients had SARS-1. It's not even COVID, it's a different virus. Some of them had MERS. A lot of them were infected late in pregnancy. So the answer of that study was that there looked like there might have been a higher marriage rate or some complications. But the study is so poorly done that a lot of people don't really think it's valid. And so to the best of our knowledge, we're saying no, but with caution as experience comes out. That has not been the local experience. Yelena, they're asking about IUIs. Yeah, IUIs are going to be coming back online as well. So that's our pregnancy and baby story. So let's, people are asking about how to stay safe and some of the bigger society issues. So people say, I work in a medical office, what should I do safe? What should I do in the community? So it's funny because anyone who lives in China, Paul here from Hong Kong, hey Paul, we know that they wear masks, and the Chinese doctors, the Asian doctors we work here, were advocating masks back in February. It does delay droplet spread. And so if you work in a medical office, you should do everything you can to distance yourself from someone who may be sick. And then if you are directly caring for COVID patients in a medical office, that's where the controversy was. The CDC guidelines were a little bit unclear. We ran an event on PPE where we had experts from Yale and NYU and Northwell Health, and the guidance was that unless there was an aerosolizing procedure, which counted as like dental work or intubation or bronchoscopy, you needed a regular mask, that special N95. But in practice, what a lot of the hospitals are doing around here is that if you were directly taking care of a patient, that you wear an N95. So if you are pregnant in a healthcare field, the official guidance is still that you could wear a surgical mask, but the recommendations are either not to go to avoid exposure, or you were there certainly to wear an N95. And so it's sort of a higher level of caution than what the official statement was. Many people are having pregnant people not be exposed, obviously, even though the evidence says it's but we certainly have limitations of how much experience. People are saying, is it safe to go to the hospital? Of course, the ERs are still filled with people with COVID. It's worse in Suffolk than in Nassau, so you do want to try to eliminate, going to the hospital if you don't have to, but people who have needed to have been going on. People are asking about a second spike in the fall, and we just don't know about that. It's the data coming out of China is very unclear. We don't know for sure whether there's reinfection. It's very unclear about immunity, whether or not you could be, whether you have the antibodies, are they truly immune? So it's not like rubella or measles where you do a blood test and you're immune. We just don't know about that yet. So, oh, Kristen, those are beautiful words. Thank you. Someone read what Kristen wrote because it's really nice. I'm going to copy that and post it because it made me smile, because we've been working like more than 20 hours a day on education and trying to get the word out about this. So I appreciate you guys watching it. And all the Long Island people, geez, did you guys get the tornado warning the other day? That was insane. We were here yesterday. I was doing a video consult, and while we're doing it, there is literally a tornado, like clouds come across, and everything turns red and it's flashing, and that was completely insane. But we ran to the basement and we got past that. So we're waiting for which other plagues are going to come, but we're going to beat this. So I'm trying to think what else are some of our questions here. So people, let's talk about some of the downloads we have. I'm going to give you guys some information to share now. We'll do it at the end because it'll take you out. You have to enter your name and your email, and we can put it up now anyway. So we have one that's really important that we want to do, that is a COVID fax. And what will happen is, if you do these, you'll just have to enter your first name and your email, and it will send you the link. So this one is a COVID fact sheet that we made, and it's all of the myths, like all the things that you may be reading online that are true or not. And we have, I think, 10 of them. So you guys can go ahead and click on that and then come back. But it's like, can COVID be transmitted where it's hot and humid? Yes, it can. Being able to hold your breath for 10 seconds without coughing does not prove that you don't have COVID. Can't get it through mosquito bites, and 5G is not the way that you get it. It's not wireless. It's not no evidence that it's a bioterrorism. It is a naturally occurring virus, as best we can tell. Spraying alcohol, bleach, and drinking hot water are all things that can be dangerous. Hair dryers and UV lights don't get rid of it. Vaccines for flu and pneumonia don't get rid of it. Young and old and all ages can get it, so please, especially the elderly, the ones that are most at risk. Howard's asking, is it possible that someone had it prior to the beginning of the year? No, there's really no evidence of that, and it's really the medical evidence doesn't show that it came to the U.S. before January, so it's not true. The antibody testing, that's a good question. We're going to be running a giant education event for physicians on testing, and you got to be really careful about the antibody test, because one of the hospitals was doing rapid tests, those aren't the antibodies, but the 15 test in Chicago, and 50% of the results were inaccurate. The home tests are not FDA validated, they're approved, so there's a lot of false positives, a lot of false negatives, and the antibody test, if you get it, we don't know what it means. It means that you were exposed, and it doesn't mean that you necessarily had it or are immune. So the idea that you could get that test and then think you're safe and go out and just do what you want and not get infected, don't believe that from the antibody test alone. So some other questions. KK's asking us the insight from the White House. Well, man, I never thought I'd be getting a call from the White House at midnight. That was pretty cool. They got interested in our events. Diane Krabal came on, who's the president's appointee from the White House for FEMA and one of the other agencies, and they came in. They actually talked to the doctors about what the federal government was doing, and what was so cool, we were there to listen about what we should do. what the doctors needed and to share what they were doing. So that was really cool. Erin, you're asking about the antibody test before the transfer. So this is like hugely being debated in our. Some centers are thinking that they should test everyone and do a rapid either for COVID or the antibody before a transfer, before you start treatment, or before a transfer, or even repeating it every 2 weeks. We're learning our lessons here. We're lucky. We're in New York, so they're going to be testing 1,000 employees a day. The hospital network here is going to be very soon. They talked to me this morning. They're going to be able to do 10,000 tests a day. So the OB offices have been open. The pediatricians have been open. So we're going to learn from them. Does the antibody testing and the rapid tests make a difference? And we just don't know that yet. So Kelly's asking about updates from ASM. They're reassessing it every 2 weeks, and we just don't think that they're going to move very quickly. So it's on the governor's office said to us directly in our event that it's between the doctor and the patient. If you feel it can't wait, it can be done. If you feel it can be safely, you can do it. So it's on that case-by-case basis. ASRM don't know when they're going to change their guidance, but there are many centers that are moving ahead in their safe way that they can. I'm going to give you another time. So here's goodie number 2, and what this one is going to be is things you can do while you wait. And so this is a guidance statement we gave. Again, it's just going to ask you for your first name and for your first name and your email. It'll send you. And I think what we're going to do, since the internet was doing what it does to make us crazy, and KK couldn't connect, we're going to give you this now to read, and then we're probably going to do a whole event on this again in a couple days. What we'll do is we'll wait. Hey, you know what you should do? You ask me now. Now I'm asking you. So tell me, what time is good for these? Like, we're trying to figure out, would you do these at 9 a.m., at noon, or at like 6:37 p.m.? So if the comments, just tell me, when should we do these? Because we're trying to figure that out. Some people have kids, some don't. Some are working from home, some aren't. So if you're watching, can you please just give me a comment and tell me our choice would be like 9 a.m., noon, or 9 a.m., noon, or like this 6:37 p.m. Just please give me a comment. Let me know what's good for you. And also let us know during the week or weekend. We've been doing them at 7 p.m. Thanks, Gina. So just let us know when the time are good. Yeah, evening. You picked right. So if you could download that thing, I'll put the link up again for everyone. But let us know day, evening, night. So top things to do while we're waiting for fertility treatments. This is from KK, our success coach. And there's a whole lot. And it's not, everyone's different. Like, some people are like really OCD, and she has things like closet makeover and, reclaim your space. Some people do exercise. Some people just take care of themselves and, do something nice for yourself. But the main thing is, I think number one that she identified is build your support team. You can't do this alone. And that's the whole point of what we have up with our meetups. You cannot do this alone when things hard. If you're not trying to get pregnant, going through COVID in New York is hard. So whether you're not sharing, if you are sharing or not sharing, it may be your partner, it may be your best friend, it may be your mom on Zoom. We're here for you. Please go ahead and build a support team around you. We have a Pay It Forward network. It's got probably close to 200 of our Miracle Family Network in it. We're all here for you. You can reach out to us. We're going to do a whole about this coming up soon. The other we have is taking your nutritional pulse. We have a nutrition program. Time to reassess what's in your pantry. People did the ice cream and pizza a couple weeks now, so now's the time to reassess how we get back on track and things to plan. But should we even have top 10 movies for future parents, things you could read to prepare? But be careful with Google. My goodness, the questions we get, even when we run these things for doctors, it is insane how much information there is, and it's be careful. If you read that stuff, reach out to us, send us emails. We are in the office every day. KK saying thank you for everyone for the patience. We're closed. We're not closed. We're just limited we can do. So we've been there every single day. We have our skeleton staff. We're in different rooms. We call each other on the intercom, and then I think I'm the one that goes and sees the patients. Barbara draws the blood. I go in and I do the scans because we're just trying to limit the number of people who get exposed of our staff and who you get exposed to for us. So we're going to here's our guide again. This is things to do while you're waiting, and you're going to hear about us to be starting. So everyone who is planning on doing treatment, we've been telling you, call us when you get your period. So if you could please, hey Rap, thanks so much for saying you feel connected. That's why we're doing this. We don't like sitting in an empty office and thinking about how to take care of people. We want to do it. So if any one of you, you can send an email to info@gcivf.com. Put that email up in the comments. And then what you can do is you can send us an email, but we're telling everyone, call us day one. As soon as you get your period, call us day one, give us the information, and we'll get you back on track, whether it's testing, treatment. We're ready to go. And we're basically there every day. So we're ready to start moving on. I think what other major questions we have. Any other questions from you guys in the audience that we haven't covered for our update? It's thanks, Regina. Thank you so much for saying that. We have I can't share photos here on Facebook. So another option, we have just questions for you guys. We have a couple of choices. We can run these on YouTube Live. We can run them on Facebook Live. We can do them privately on Zoom. Do you guys have a preference of which platform? People were telling us the most people are on Facebook. So tell us, Rap, if you're on the birth control pill, you just call us. Aaron, Tony, yeah, we're contacting everyone. But yeah, Caroline, Barbara, they're doing everything they can. We're calling everyone, but we just literally started calling everyone today, so we've got a whole extra staff tomorrow going down the list. So yeah, Eileen, we are going to begin doing IUIs and IVF again. So anyone that's on pill, if you don't hear from us by the end of the week, give us a call. So just send an email. Anything but YouTube. Send an email to us if you're on the pill. We have a list. We're just going down it, but just with the scheduling crew, we're not calling everyone. Rap, we're hoping that everyone can start. Obviously, the people who were in the middle are going first, but we're hoping that we don't have to turn anyone down where it's safe for them to move ahead. Tanisha, what were you? Sorry, you were worried. So yeah, Aaron, definitely reach out to us. Just send an email. We haven't forgotten you. It's just we play phone tag with so many people. No one answers their phones. Everyone's busy. So we're calling everyone this week that we know of. Sometimes if we called, we got voicemail or you didn't hear it. So guys, just send an email to info@gcivf.com. We will not forget you. No one will be left behind. You know how it's when you come in the office. We know who you are. We know your face. We know who's waiting. But it's just a matter of, if we dial wrong or get the wrong digit, we want you to know that we're here. So just reach out to us. We're going to have a cool event tomorrow for National Infertility Awareness Week. It's going to be a whole patient event for empowering patients that they asked me with sort of the education stuff we're doing to help educate people. I'm going to see if I really to help them put it on. I'm going to see if we have the link. Give me a second. We're going to get the link for that. So it's going to be comedy. It's going to be just sort of refocusing some celebrities and people talking about how they're going to move together. And I'm not the PC. I'm just sort of the guy behind the scenes making the technology work and making everyone come together. So I was happy to help them. It's a fundraiser for Resolve National Infertility Awareness Group. So what I would tell you is you can come to this tomorrow at I think it's going to be at 7:15, and I'll put the link up here where you can register. That one's going to be on Zoom. I'm trying to not go crazy with YouTube. So again, was everyone, and you can fill that in later. The comments will be here later. Just hang out with us for a few more minutes before everyone goes. That's where the comments, you'll be able to register for that. Any other questions that you guys have from the audience? Oh, I want to give you a cool link. So this one's amazing. I can't play it in the browser because it's YouTube, and Facebook Live doesn't like you playing YouTube videos, and it's like famous copyrighted music. So if you play that, it ends. So I'm just going to ask, do you have the link for me? We're going to throw the link up. It would be the link from the YouTube. So don't watch this now. Come back to the comments afterwards. So this is really cool. So KK, our success coach, everyone that we have has their hobbies and their jobs and their hidden talents. Well, KK is like a professional musician on the side. And so is Adam, her husband. People have many, many talents. So what happens is they did an event where they took like all the long musicians and got them together to play We Are the World. And they did it over Zoom, and each one like did a piece, and they mixed it together, and they made this video of like all the stars of Long Island playing We Are the World. And the thing went viral. It's got like hundreds of thousands of views. It's being watched like in rural parts of Ireland, and people love this thing. And if you know any Long Island music scene, you guys will totally love this. So I would encourage you to look at that when we're done. The link will be here. It's a kind of long video, so don't watch it right now. It's music, but it's totally amazing. So I would ask you guys to look at it there. I'm going to see if I can show you guys some pictures, because again, Facebook won't let me share it. So I'm just going to share with you the highlights of the week. So that's the tornado passing overhead, the red. That was our house. And I'm going to show you some like incredible stories. Like this is the feel good part. So someone who works in Hollywood sent me this. This was the Muppeteers did from their home. Each one of them did like a Muppet thing for kids that were really homebound and depressed, make them think about sort of the good times, and we're like a play date that they did. And my star, Miracle Mom, boy, this woman is one of our success stories, and she told me I could share this. She used to work in the PACU, which is the recovery room. And so this is her team. They're the COVID warriors, and they turned their recovery room into an ICU. And you know what I love is that they start off, the first pictures were people like terrified and sweating with the masks on their face. And these are like, this is Northwell, this is our local hospital. These are the ninjas. I mean, this is my Miracle Mom, and now they're ninjas taking care of thousands, like 2,000 patients with COVID, and they're discharging them every day. So you are a star, guys. Virginia, love you guys. I'm going to show you, this was, from my partners in Wuhan. They sent me this the first week, and look, it's the same thing. Like they band together, and they're like ninjas, and they like, they do this thing, and they all band together like we're going to beat the virus. And that was their story. Like we asked them, how are you going to get through it? And they said, the guy really said, you're going to see things that you've never seen, and you're going to get so good, so fast, and you will come out. Like you can't believe that's like, it's like kind of hokey. Something good that'll come out of it. Medicine's going to get better as a result of this. We're going to be stronger, and the people, like a lot of people, didn't survive. We're in New York. We know that. We've seen it more than anyone. But Regina, you are a star. But people who get through this, we are going to be able to do more. And that's what the woman from China said. She said, like, we ran in to take care of our patients. And we didn't, like, she was, I'm an obstetrician, I don't know virus. And she says, we ran in and they were in labor, and I had to get the baby out, and I didn't have a mask. And she said, all the doctors got sick, and they went home, and many of them family died. But she said, then we learned, and we're going to share with you the message about how to win. And that's what we did for the doctors. We taught probably 8,000 docs by now, the stories of Wuhan. Then it was the story of Italy, where we said the same thing. Here's how you take care of yourself. Here's how you beat it. And you will learn things and get really good really fast. And I love this picture. So this was this week. This is our social distancing. I don't know if you saw this one. How do I do this? Okay, so this was us social distancing. This lovely woman, she said we could share it. She came in pregnant. We had to make sure she didn't have an ectopic and everything was good. This is our virtual high five. So it's me, and then Barbara is like 6 feet down the hall, and then Grace 6 feet down the hall from her. And we were doing like virtual high fives to say the end is near and we're on the other side of this, and we're going to beat it. So that's like, there is good news coming out of this. So if you can survive the supermarkets around here, you can totally survive the doctor's office. That's like the most terrifying place I've had to go. Is the supermarket? It's like zombie land around here, and people are crazy. But if you guys, we have learned the lessons from them, and we know how to do this safely. We're running event talks, and we are going to be open. So reach out to us. If you found this interesting and informative, we're going to do more of them, and we will ask you guys, send us email questions. We have over 200 questions, so we're going to be running events just on general fertility, and we're going to be running our meetups this way too. So we're going to be focusing on things you can do. We'll do a thing about your network, we'll do a thing about nutrition, whatever you want, we're here for you, and that's it. So let us know how we can support you. Let us know that you're safe. Check in anytime. People are worried to bother us. Please email, call. We don't mind. There are a lot of clinics where they say they just leave a voicemail and they don't hear from someone. We're here every day. We're there. So if you reach out to us, we'll answer the phone and make a bunch of rings. But we're there for you. And if it's not emergent, just send us an email. And 4 hours a day, we look at them. We're here for you. Emergencies, call the service, as you know, and we can't wait to see you in person. So that's it. National Infertility Week. I'm going to put up the registration for the event, for the celebration. I'll be participating in tomorrow, and we're here for you. So I'm going to put up all the downloads one more time. So that's that one. Here's While You Wait. Here's things you can do while you are waiting from our team. And last one is going to be the myths. So your grandma or your mom calls and tells you that if you drink really hot tea and gargle with alcohol, you can tell her, no, that's a hoax. Here it is. So KK, can't wait to see you guys again too. The internet gets crazy here when people are video conferencing. It's just so, like, these days a day are so crazy, but we will have the rest of the call with us. And stay safe, stay healthy, be in touch, reach out to us, and we're ready to get going, and we want to hear from you. So I'll see if there's any last comments. We'll leave this up, and we will. Heather tomorrow. We'll be there, but don't come in. You gotta call first. You gotta get screened before. We gotta check you for symptoms. We gotta check you for fever. This is really important, guys. Don't let your guard down. Okay, like listen. Opening doesn't mean this is over. We don't know when this is going to be. Take this like deadly serious. We're going to do this safe way. We're not going to be the dangerous place. It's going to be the supermarket, right? Going to stadium. It's like, until we know it's gone, do what you're doing. Italy and China taught us, if you keep your distance and you wash your hands and you don't touch things that other people are touching, it ends. So do that. Just whatever you're doing now, whatever everyone's doing, the danger is just to let your guard down in the next month. So don't be scared. Just do exactly what you're doing, and you're going to win. So that's it. Maria, Marianne, it's gonna. I think if these are recorded, they'll replay over and over and over. Share it with your friends. Like us on. Oh, I'm supposed to tell me. You're supposed to like us on Facebook so you see the updates. Because when we see that we send out the invites, you don't see it. So please. You do, I guess you like it, or if you're one of our patients, you've been with us, leave us a review so we know, people know what we do that's different, and connect with us for you. So that's it. It's so nice to talk about this with sunshine, a sunshine way to end. I've been talking a lot, and when I talk, I start coughing, and then people freak out. I got COVID. So the funniest thing was I was recording Facebook Live in the park and I didn't know how to end it. So I'm safe. I want you guys to stay safe. We're here for you. Don't let your guard down, and we will be here with you. All right, guys. We love you all. You're our family, and we are on the other side of this. We're crossing on the mountain. Stay safe, and we'll be in touch soon. Take care.